It's that bone broth because the glutamine, the amino acid in the bone broth, is very healing for the gut and repairing any damage that you may have been exposed to. Now, what about bone broth and cancer? Will it be fueling cancer's growth, or will it be supporting your immune system to fight abnormal cells? Now, we all know for thousands of years that food can act as medicine, but when you have too much of one thing, is it actually having a harmful effect to your cancer journey, or is it making you strong and protecting your system and helping with natural killer cells and your lymphocytes and everything it takes to have a robust immune system? Now, bone broth became popular because of the high gelatin content and also the high glutamine content, which is critical for how your gut performs and the integrity of the gut lining. Now, the reality is most people who have a cancer diagnosis or who have gone through cancer treatments will have a damaged GI tract or gastrointestinal tract. And that's just the reality. Most people actually do have irritation or inflammation in the gut from other sources as well. So antibiotics can cause that, medications of any type, exposure to glyphosates and pesticides, herbicides. If you're ever a smoker or living in a highly polluted area, chances are that your gut has some form of inflammation. And the way that you can check that is looking at your zonulin levels. So zonulin is basically a gatekeeper of how tight these cells are in your GI tract. So we all have what are called tight junctions. So if zonulin is higher, these junctions are not as tight, creating leaky gut. So it's allowing proteins and the food that you're eating, all of these, even like bacteria overgrowth, parasites, things to actually get into the bloodstream when really it should be leaving your system out of your gut. And one way that you know, other than testing for zonulin, that you have leaky gut is by if you have any autoimmune condition or skin condition, if you have protein malabsorption, if you're just getting a lot of bloating or gas, basically anything that your body is expressing likely is coming from your gut. So when people Google, how can I repair my gut health? What can I do to strengthen my immune system and really support a strong digestive tract? One thing that comes up is bone broth. When I host retreats in my clinic, Inside Health, I use bone broth all the time because I just assume that most people's concerns or health concerns are because their gut is compromised, and we know a lot of diseases start in the gut. So doing bone broth on a daily basis, incorporating with other highly nutrient dense foods and drinks and supplements to help repair the system will really pivot the outcome of someone's disease process. But for cancer, we do not want to have too much of a good thing because you've likely heard that glutamine can also trigger and fuel a cancer's growth. Now, how true is that? Do we need to completely remove glutamine from the diet and compromise all of our healthy cells in the gut? And you probably know the answer just by the way I'm asking that, because if you're starving one source of fuel, cancer is so intelligent that it's going to try to find another way to kind of grow and to get fuel from the system. So I definitely don't recommend avoiding one source of just say all the proteins that could possibly have glutamine in it, because you'd be sacrificing all the healthy cells that actually need that for a strong system and to repair your body from the GI tract, from the immune system. Even it's really important for that gut-brain connection. So for our mood, for anxiety, depression, it's really critical we get enough protein in our system. Now, when you're looking at the source of bone broth that you're getting, I want you to look at ones that are antibiotic-free, hormone-free. They come from animals that have not been abused, and you're actually looking for the healthiest source of bone out there. So you can get pre-made ones, which I get because it does take a long time to make it, and that's a whole nother video on how you can make a really yummy bone broth. But you can add in tons of vegetables to this. The company that I like is called Boned Broth. It's certified organic, and it does have carrots, onion, celery, apple cider vinegar, sea salt, garlic, various herbs, and they're all certified organics. So it's very important that you're looking at the source of where these bones are coming from, because the opposite could be true. If you were having bone broth that wasn't organic and that was full of preservatives and different sulfites, you can actually have more of an inflammatory reaction. Also looking at what the cows or the chickens are eating. If they're having a corn-based diet that's been filled with glyphosates and different chemicals, so if you're reaching for a bone broth without checking that, then it can do more damage than good. It can create more inflammation in the system because everything that animal is eating is now going to be going into your system. The other thing that I really like about bone broth is it's high in potassium, which is critical for how our heart functions and every cell in our body, how that electrical charge, how we communicate with one another. Most diets are too high in sodium, so people craving salt and having too many carbs, the sodium content, if you eat out ever, sodium is usually pretty high. So it's nice to have a balance of foods that have higher potassium just to support your system. Another way that you may know that you're potassium deficient is if you have very high blood pressure. So foods high in potassium are very important. You don't need to overdose on bananas to get that. Bone broth is an excellent source, and same with avocado can actually be added to the bone broth as a healthy fat, just getting extra minerals into your diet. But when is it too much protein? Do we really need to supplement with bone broth on top of a healthy diet that will have various other animal proteins, or nuts and seeds? Even vegetables have a considerably large amount of protein and very digestible as well. So if you're supplementing with protein powders and have a really complete healthy diet, and then adding bone broth, which has 5 grams of protein just for 250 mils, you can actually go into a system called mTOR. So mTOR is the muscle building effect in the body. It can actually tell cells to divide faster. And we do not want that. We do not want to go into this mTOR pathway all the time. So the amount of protein you're getting in the day, you want to have about 50 grams. Some people say more depending on their body weight and what their goals are. Looking for muscle building, you may want a little bit more, but I'm a huge fan of diet variation. So going high protein all the time, stimulating this anabolic pathway with mTOR can actually be quite critical to your cancer journey. But on the other hand, if you do not love having animal proteins, or you know that you're definitely not getting even close to that 50-gram mark of protein in your day, then bone broth would be a really great thing because you're supplying all those amino acids, especially the glutamine, to help repair the gut lining. In small amounts, I would not worry about this source of glutamine. You're not going to be stimulating abnormal cells versus having a high amount of the glutamine that can have quite detrimental effects. And this is especially the case in more late stage cancers, where the glutamine and the high protein content, your body just cannot handle it. Usually kidney function is also compromised, so to break up these proteins into amino acids having to be flushed through the kidneys, it can be very tough for your body to handle that. So early stage, where first diagnosis, stage 1 or 2, where you want to really build up a strong immune system, yes, glutamine and bone broth in moderation, completely fine. I also wouldn't supplement with glutamine. I wouldn't be taking the powders. Unless you have reactions from chemotherapy, getting mucosa inflamed, glutamine is very healing for the entire gastrointestinal tract from the mouth right into the rectum. So if you have any chemo side effects and there's a short-term use for glutamine supplementing, that is fine. Same with getting the glutamine from bone broth, that's fine. But to go in excess, absolutely not, and especially not in late-stage cancers. If you're looking for more information and free resources, make sure you check out my drlori.ca page, where I give away a lot of information, and you can have access to my book, Cancer Doesn't Own You.